Thank you for the lovely introduction, Roger. I I did have my PhD studies at UCD in Dublin, and I later worked for a while in Derry, so very familiar with Ireland and my second home. So it's good to talk to you today. I am based in Singapore now, and at the Singapore-ETH Centre, I focus on a program called Future Health Technologies and how we can leverage on technology to promote health behaviours, including physical activity. Yes, so as with many countries around the world, Ireland is moving towards a super age society, and that means that more than 20% of the population are aged 65 years or older. And that brings, of course, increased demands across all aspects of life, from burdens on the economy and healthcare services to societal shifts and changes in family dynamics. In parallel, similar to what Adrian has already presented, we do see marked shifts in health promoting activities. So, for example, these data show a sharp increase in physical inactivity from age 60 years upwards. So moving on, in the Healthy and Positive Aging for All research strategy in Ireland, there are 4 key priority areas that were identified: health, participation, security, and cross-cutting themes such as technology and information. What I would like to share with you today is where I think digital innovation can contribute to these priorities and this research plan for Ireland, why I think technology is an important part of the plan, and how I think it can be leveraged, not only for behavioural change, but as part of a journey to realising successful ageing. So my team at the Singapore-ETH Centre focusing on developing and evaluating digital health interventions, and we've structured our work around innovations specifically in what's called digital therapeutics. So these are patient-facing therapeutic interventions delivered through software, for us mostly through the smartphone, to treat, manage or prevent a disease or a disorder, but also to promote good well-being and to help people thrive. We focus a lot of our work on what we can do with the smartphone alone. Firstly, because smartphone adoption, again, as Adrian has pointed out, is very high, with many age groups actually at 100+% penetration, and older adults are not far behind. What that means is it's possible to scale our interventions and reach much more or many more people through these devices that they already have. Second, as a communication device, interventions that are delivered via the smartphone, when they're carefully designed, can promote social connectedness and increase access to support from the right people and the right services when they're needed. And third, through the ability to collect data, whether that's passively or actively through technology, and by leveraging on AI in a safe and ethical manner, we can provide support to people that is truly personalized and adapts to their changing needs over time. So this all sounds very promising, but it's not so easy and straightforward to achieve. So there are challenges. Firstly, digital health apps are distributed through the app stores. And technically anyone can develop and deploy a health app. You don't need to have qualifications or experience, and you don't need to base it on any behavioral theory or clinical evidence. You don't need to prove it's effective. Actually, no requirement for regulation of apps on the App Store. What that means is that there's an overabundance of options, and many people struggle to know what is useful, safe, accessible, effective, and affordable. Another issue is the well-known law of attrition. So in this paper, it demonstrates that for commercial apps, and here it's showing mental health apps, you can expect to lose about 90% of initial users within the first 7 days. Research apps fare slightly better, but you can still expect, even with the most rigorously designed interventions, to lose 50% of the users within 1 month. And another challenge is that the health app adoption is not even across the population. So we tend to see that the people that we reach with digital interventions are mostly highly educated females with high income who are already active. So in other words, the worried well. So what do we do about this? Well, I don't think that we necessarily need more apps, but we do need better ones. And that's exactly what our team here tries to do. We try to focus on solving the underlying issues and problems rather than trying to develop more and new things all of the time. So how do we do that? I wanted to highlight to you two things. The first is that we need to remember what we're actually trying to achieve through these digital interventions that we're developing. And that is really that we're trying to empower people to make changes to their physical activity, to their lifestyle that helps them to thrive. So for decades, many of our interventions have tried to achieve that by focusing on education and knowledge, often in a one-size-fits-all manner. But this recent paper from Albers and et al., it shows that knowledge is actually the least likely strategy to change behavior. And this is health behaviors across a wide range of interventions. What is actually more effective at an individual level is firstly building on healthy habits, secondly tapping on emotions that drive behavior, third uncovering attitudes towards behavior and addressing ambivalence to change, and fourth building skills and formulating implementation intentions. So all four of these strategies can be delivered quite nicely in a personalized health coaching situation. The problem is that providing coaching to every individual is not feasible or sustainable. And actually, most behavioural change doesn't happen in the clinic or in that face-to-face, in those face-to-face moments. It happens in everyday life, often when support is typically unavailable. So we need to rethink this, and this is the second point that I want to highlight today, is where does the digital innovation come in? Excuse me. So first, we sort of, before we embarked on our work here in Singapore, we wanted to know what have we learned about digitally delivered health interventions. So to answer this, we conducted an umbrella review of systematic reviews that covered 12 different health domains. And we looked specifically into what digital components are the most effective so that we can build upon the most promising strategies rather than starting from scratch. And we found that human coaching, personalization, prompts and cues, goal setting, self-monitoring behavior, action planning, graded tasks, feedback on outcomes, and social support are the most effective strategies in digital health interventions. As well as that, I already raised the issue of the law of attrition, right? So we wanted to know what factors are really increasing the stickiness of apps, like what really drives people to stay using a health app, and what influences adherence. And similar to what we saw with effectiveness, communication with the professional, personalization, prompts and cues are also promoting adherence. In addition, we found that people are more likely to stick to apps that offer social support and gamification, passive sensing or automated data collection, financial incentives, and good user experiences. So armed with this information and building on all of this knowledge, in Singapore, we've built a digital therapeutics platform from the ground up on behavioral science. So we're not trying to develop technologies and apply it to the behavior, but rather really trying to develop from the behavior from the ground up. leveraging the most promising strategies that change behaviour and delivering them in the most effective ways through technology. So this platform is designed to be modular, adaptable, and reusable across different use cases and conditions. So it's not specifically for physical activity interventions, and it's not specifically for a condition like diabetes. It should be able to be used across different healthcare challenges. So we don't reinvent the wheel every time. We have a healthcare challenge to solve. Instead, we build upon this strong foundational strategy and then tailor the approach as needed. The idea is that if we build apps on this type of platform, through small sustained changes over time, we can drive meaningful health improvements and then ultimately enhance human potential. So we've already demonstrated the capabilities of this platform here in Singapore through the Level Up holistic lifestyle coaching intervention. So here we've built an evidence-based and motivational interviewing inspired digital coach, which has an interface very similar to WhatsApp, together with some self-regulatory behavioral change strategies like self-monitoring behavior and goal setting, together with social support via WhatsApp integration to support people to change their lifestyle behaviors. In pilot work that we've done with this app, we demonstrated positive shifts in lifestyle behaviors and mental well-being after 8 weeks. And the early results from our large-scale trial that we're currently conducting have shown improvements in health behaviors and reduced symptoms of stress, but also quite good adherence. So if you compare this to what I showed you previously, after 7 days, we only have 18% loss of our participants, and we've retained them a lot longer than in typical apps. But of course, technology moves very fast. And since we've built that initial Level Up intervention, we've been bombarded with AI, with large language models, and so on. So what we're working on now is innovating 2 key components of this platform. The first is a nudging component, or a sort of prompts and reminders component. So we try to develop context-aware nudging and messaging. And we're trying to do that in a slightly different way by also considering whether someone is in a moment where they're receptive or available to receive an intervention. So using this large data set of sensing data that we've collected over the last 5 years, we're training machine learning models to make a prediction about whether this is the right time for you as an individual to receive a notification related to an intervention. Test that out and using profiles that allow us to test whether this actually works. A second thing that we're going to do is the coaching interventions that we've delivered previously have been what we call rule-based interventions. So everything is predetermined and evidence-based, so it's designed ahead of time, and there's no deviation from the content that's delivered. But with large language models, there's a much more exciting way of personalizing the content of delivery to an individual's specific needs. But that also comes with challenges because you need to be able to control what's being delivered, you need to know it's safe, you need to know that it's ethical, that it's not biased information, and so on. So we're currently looking at how we can harness on large language models, and we have a lot of coaching data that we can fine-tune these strategies on. And we can tailor this to specific use cases. So we can tell a model, for example, that this is an intervention for falls prevention. You need to use the knowledge base from this repository of information and so on, so that we can specify the intervention content. Finally, we believe that technology alone is not enough to sort of support people in a behavioural change journey, or not to support everyone. And so there has to be a human connection. This is very important for health behaviours. So we've deliberately built the platform to integrate social support and blended human support components. So what we've done so far is we've piloted a peer coaching strategy. I mentioned that through the WhatsApp integration previously. But what we're looking at now is how we can introduce tiered escalation mechanisms. So for example, peers can be available to support someone in their physical activity journey by standard. But for those who are not, that really need additional support, we can offer them, for example, trained coaches or even clinicians. So this is the sort of framework that we're using for this concept of precision digital therapeutics moving forward. So some final thoughts that I wanted to share with you before I wrap up. Having worked in this space for the last 10 plus years and doing some things right, but many things wrong, for anyone that's developing and evaluating digital interventions for physical activity and health behaviour change more broadly, I wanted to share the importance of co-production with people throughout the entire process. So the process of developing a digital intervention includes key considerations along the way, and not necessarily in a sequential manner. So, for example, building on a behavioural science foundation is very important in the beginning to understand the problems, the individual's needs, to empathise with their motivations and context. And then as you move forward with that understanding, you enter a process of design thinking and agile methodologies that allow you to create and develop this technically enhanced intervention according to regulatory standards, but also to make it really attractive and enjoyable to use. And then you would move forward into how you're going to implement that intervention. But what I want to highlight is that we cannot wait until the end where you've already developed an intervention to think about implementation. That implementation thinking has to happen at the very beginning. So these four things interconnect. And if we can look at the intersection of each of these circles, we'll be able to create digital interventions that are usable, accessible, engaging, and sustainable. A final point I want to highlight is around the successful adoption of digital technologies across the population. And I am often asked about whether our interventions are suitable for the elderly or for those that don't have access to fancy devices. And my answer is yes, because we have deliberately designed our interventions with drivers of health app adoption in mind. Now, what are these drivers? So a couple of years ago, we conducted a patient public involvement study in Singapore, inspired by PPI cafe methods, where we went into the local hawker centres where most Singaporeans eat on a daily basis in a very informal setting to just talk to people about what they thought about digital health. So we brought the research to them rather than expecting them to come to us. And we spoke to a really diverse group of people, sample of the population, some with experience using digital interventions and some that do not have experience. And all of the conversations centered around 5 key themes: awareness, weighing benefits against burdens, accessibility, trust, and user experience. And what we did with these themes, we mapped them to the behavioural mechanisms of action to try to identify what could be the most promising behavioural change strategies or techniques that could be used to influence adoption across the population. So for example, if you want to raise awareness, if you want people to be more aware of what digital interventions are available, influence their assessment about whether it's going to be worth the effort to use, and then increase the accessibility of that intervention, then you can focus on community-based support, for example, digital literacy training, information sessions, or promotional activities. Taking the opportunity to introduce a health app as part of a brief counselling session, for example, by a GP or a pharmacist, could be another way to increase awareness and shift that balance of benefits against burdens. We also heard people talk about how financial incentives like earning points and redeeming them for shopping vouchers can be a useful way to get them to try new apps. But it doesn't work for everyone. And so rewards that are more tied to people's values might be more useful in a wider group of people, such as, earning rewards that can be donated to charity. And just before I finish, I know I'm going slightly over time, but just to mention that people are very influenced by accessibility and trust, and whether the app offers bang for buck in terms of their effort. So regulatory approvals can go some way to give people confidence that an app is reliable and safe. And very last point is that people make very fast judgments about health apps within 4 to 5 seconds of first use. If you lose them then, it's unlikely you'll get them back. So the importance of a good user experience cannot be underestimated. Thank you so much for your attention and looking forward to the panel discussion.